Well, among the ructions in the northwest, recent protest action there saw striking health workers disrupt medical services, damaging public property, leading to staff shortages, sometimes the closing of clinics and hospitals. All the while, hospitals called on government to provide protection. This comes amidst an already deteriorating public health care network in that region. To tell us more, joining us in studio now is Executive Committee member of the Public Health Association of South Africa. That's Professor Stephen Hendricks. Thank you for being with us, Professor.
Really?
What is your experience of health in the Northwest?
Well, I think I've had the opportunity to do training, capacity building of healthcare workers.
Is this nurses, doctors?
Nurses, doctors, staff at the operational level, and also had a follow-up impact assessment of the training about 3-4 months ago. There's the goodwill, I think, of the workers to make sure that the services run, but there are sort of dire problems that I did find on my research when visiting the community, the households, where the health workers to visit, where the community health workers to visit. And I think
examples.
Yeah, for example, you'll find that there's times medication is not available. Patients will say, I went to the clinic, I'm told to come back. There are issues also of quality of care. Some health workers work very hard to uphold the quality of care, but in some areas, there's very much of a don't care attitude. And I think the intervention team that was sent by the President, led by the previous Minister of Health and now the Minister in his office in monitoring evaluation, I think if given a chance, they'll be able to ascertain exactly where the challenges are. But also I want to add that the social partners, the organized labor, the unions, our challenge in management side of health is that often we don't engage with them. We don't talk with them during times of peace. We wait for the challenge to come, and then we start blaming the unions for all the trouble that's in the country. And I think that is the other lesson that I've learned in training managers in the health sector. You negotiate, you work, you talk with unions during time of peace, you come to some conclusions, you come to some agreements, you make them part of the solution and not the problem.
Yeah.
And I think this is one of the things that's happening here. And it's obvious, workers will become frustrated, they'll take out their frustration in various ways like we've seen. And in this case, it's unfortunate because the very patients and community that I visited in these areas, they would want health services. They appreciate the health services.
This is very sad. You've raised a number of issues before we get to the Nahawi strike and the politics. What do you think is the main issue? Is it a lack of resources, a lack of staff? Is it an attitude, which you've mentioned? Is it supply chains, medical, or is it all of it? Yeah,
I think it's partly all of it. But in particular, I think it's the failure of management to engage with workers very early on. You know, sometimes some people wait for a fire, but you can see there's smoke bezzling out somewhere.
Yeah.
And when the smoke comes, no one takes notice. And that's when unions get very frustrated because they are saying, we go to the management, we knock on their doors, they don't listen to us. And so I think what I've seen is that it affects the quality of care, because it means now you can't access the services. It means now that the medication that's supposed to be available is not there. And I don't blame the unions for the attitude that they have. And I lay it again squarely at the doorstep of management, who have not intervened early enough when they saw the signs on the wall.
And how is management linked to politics? Because Nahawu has complained about the Premier, saying corruption is rife. That's affecting even the day-to-day work of nurses in hospitals. Is that true?
Well, I think we must remember that Nahawu was part of the unions in an alliance with the ruling government. So I think at that level there are discussions being conducted. But it's true, the assertions of Nahawu to the extent that the attitude of nurses is problematic, people not coming on time to work, and also the quality of care. The Minister of Health introduced the Bartopile principles and also the quality of care domains. But the extent to which it's implemented and the extent to which health workers take ownership and implement it, like they would have for themselves. I mean, most of them go to private sector facilities. So the question is, maybe that's where it's lying. To what extent do I, as a health worker, as a medical doctor, as a specialist, as a nursing sister, to what extent do I begin to implement the principles of service delivery?
Well, how much do you take? Because Nahawu has serious concerns, some of them political. The union wants change. We've already been covering what's been happening with the strike. We saw a dead body still attached to machines that hadn't been removed. Now Nahawu talking about another shutdown next week. How do they balance that, the need to get action and to get a response, and their care to the people on the ground?
I can understand the frustration of Nahawu. They have been pleading for change. Unfortunately, there are many other government departments in health that's been placed under administration in this country, and we didn't have the consequence like we have here. I think here, because it's linked to the political head of the province, that makes it even more complicated. Hence, the president sent in a team to deal with that issue.
And health is under administration. Does that help?
It doesn't help at all, because in fact, that delays decision-making, it delays authorizations. Treasury has to send the administrator to co-sign of documentation.
So there's more bureaucracy.
There's more bureaucracy.
Sure.
And of course, let's look at the patient. Here, mama comes for services, a regular checkup, a follow-up visit. There's no one to see her. She's chased away from the clinics. So I think the quicker this matter can be resolved, and that the unions and management find each other, not so much as unions and management, but as fellow South Africans, and begin to engage on that principle to say, what is best for the people of Northwest? It's difficult, because when you're in the height of the moment like you are now, it's difficult to engage with organized labor. There's also the intransigence of management, not perhaps to move forward and to consent and say, yes, true. You know, we've made mistakes, we've made errors. And I think that's the other part that's missing, I think, in the formula.
Finally, what does it mean for Mama, who is very sick, and now Nahawu is talking about a shutdown, a complete shutdown next week? I mean, how serious is this for the people of the Northwest, based on what you've seen?
Well, I would plead with Nahawu. Yes, I understand their frustrations. I understand that they have rights, and I understand that they have raised the issue to the highest level. But I would plead that they give some space just for negotiations to settle down, because it's the public in the end who also supports organized labor. And by the way, organized labor comes from the community, the very community we are called to serve. And so I think there is the appetite for solutions, but I think it's how people speak to each other and also recognize each other's strengths in negotiations, other than just running down the unions and saying, these are bad people, you know, look what they are doing. There's a genesis somewhere. It started somewhere. And at that point, the management was too slow to pick it up. And so we find the consequences now. And of course, you know, one of the things that we do not have much of is consequences management, which is so critical. And I think organized labor needs to look at that. You know, what's the consequences? How are we going to manage that? The management side must look at it. Those managers who did not act, who did not perform, who did not implement the policies, they must be dealt with.
So the consequences are really serious. Thank you,
Thank you.
For giving us your insight after being on the ground in the Northwest Province. That was Professor Stephen Hendricks. He is the Executive Committee member of the Public Health Association of South Africa.